In this lecture, we will discuss about the general principles of management of poisoning. Now, broad guidelines to follow in treatment of poisoning are: first, immediate resuscitative measures; second, removal of unabsorbed poison from the body; third, removal of absorbed poison from the body; fourth, administration of antidotes; fifth, symptomatic treatment, and then adequate follow-up. Okay, so these are the broad guidelines. Now, we will discuss about the immediate resuscitative measures. Firstly, remove the patient from the poisonous environment. Like if some patient is in a smoky room, then you have to remove from it there to prevent the absorption of more carbon monoxide into the inhalation of more carbon monoxide into the system. Okay, now then follow Scandinavian method of treatment, that is A, B, C and D. First, airway. Protect and secure airway by the way of endotracheal intubation, and you can do anything to secure the airway. Now the second is the breathing. Use supplemental oxygen therapy for breathing. Okay. Now third is circulation, that is IV fluid administration. It can be life saving sometimes. And the fourth is the depression of CNS. It should be corrected as soon as possible. Okay. So how do we manage the ingested poison? First step is gastric lavage or stomach wash. It is useful anytime within 3 hours after ingestion of poison. Done using a stomach tube known as Ewald's tube. Ewald's tube is 1.5 meter long and have a diameter of 1 centimeter. The position of patient should be prone and left lateral and in Trendelenburg position. Trendelenburg position is when the head is down and the foot is up. So this is the image of an Ewald's tube, and this is how the peritoneal management of ingested poison by gastric lavage is done. The water is given from above, the solution is given from above, and then it is stomach is washed. Okay. Other types of tubes that can be used are Boas tube, it is similar to Ewald's tube; Edlich tube; Levacuator, also known as double lumen tube, or it is ideal for gastric lavage; Ryle's tube, it is used in children. So this is an example of a Levacuator, and this is Ryle's tube. Now, gastric lavage may be done with different solution in different poisons. Solutions used: first is calcium gluconate, lactate and other calcium salts. It is used in poisoning by oxalates. Now, other poison is the castor oil with warm water. It is used in carbolic acid poisoning. The other is desferrioxamine. It is used in iron poisoning. The another is potassium permanganate 1:5000 solution, which is used in oxidizable poisons like alkaloids, phosphorus, salicylates. Okay. Now potassium iodide, sodium bicarbonate 5%, sodium iodide 1%, tannic acid. They are used in general poisoning as solution for gastric lavage. Now what are the contraindications of gastric lavage? So that gastric lavage should not be used in these cases. First is the absolute contradiction. The corrosive poisoning except carbolic acid due to danger of perforation. It should not be used in corrosive poisoning because there is a danger of perforation, but can be used in carbolic acid. The second is, in the following condition, proper precautions must be used, like in convulsant poisons. It may lead to convulsions. So the gastric lavage is done after convulsions are controlled. In comatose patient, there is a risk of aspiration, and it should not be used in volatile poisons and upper alimentary disease. Now, the second thing we can use for ingested poison is emetics, used only if there is difficulty in obtaining or using a stomach tube. For example, ipecacuanha powder. Okay, so these are the roots of ipecac, and this is the powder of ipecac. The dose for adults is 30 milliliter. For 1 to 12 years, it is 15 milliliter. For 9 to 12 months, it is 10 milliliter, and for 6 to 9 months, it is 5 milliliter. We will discuss now about the removal of unabsorbed poison from the body. The first process is urine alkalinization. It increases poison elimination by administration of intravenous sodium bicarbonate to produce urine with a pH greater than 7.5. The principle behind this is unionized ions can freely pass through biological membranes while charged ions cannot. Urine alkalinization is useful in barbiturates, salicylates, diphorchlorophenoxytic acid, macroprop, chloropropamide, fluoride, methotrexate. Now the second procedure is forced acidification, also known as forced acidic diuresis. It is done by giving intravenous ascorbic acid or ammonium chloride. The target pH in this is 5.0. The mechanism is same as the alkalinization. It is useful in methadone, amphetamine, phencyclidine, cocaine, quinine and strychnine, nicotine and strychnine poisoning. Okay. The third option is hemodialysis. Hemodialysis, it is a method of removing metabolic waste when kidneys are in renal failure. It is useful in BLAST. This is an acronym so that you can remember it. The barbiturates, boric acid and bromides. From L we get lithium, A for alcohol, S for salicylates and strychnine, and T for theophylline and thiocyanate. Okay. It is not useful in these A, B, C, D, OP. Anticholinergic, antidepressant, antihistaminics. B for benzodiazepine. C for chloroquine. D for digitalis. O for opiates, that is morphine, heroin and paracetamol. Okay. The fourth step is the peritoneal dialysis. It is a procedure in which patient's peritoneum is used as a membrane across which toxins in blood are exchanged. Poisons effectively removed by peritoneal dialysis are alcohol, barbiturates, bromides, chloral hydrate, lithium, mercury. What is hemoperfusion? It is a procedure in which large volume of patient's blood is passed over an adsorbent substance in order to remove toxic substance. It is useful in acetaminophen, barbiturates, carbamazepine, digitalis, paraquat and theophylline. Now antidotes. What are antidotes? Substance which counteract or neutralizes the effect of poison. The first is mechanical or physical antidote. Example, activated charcoal, fine black odorless and tasteless powder. It is a fine black odorless and a tasteless powder. Its mechanism is it mechanically adsorbs and retains poison within its pores and delays absorption from stomach. So dose in adults is 60 to 100 grams in about 250 milliliter of water, and child it is 15 to 20 gram or 1 gram per kilogram. It is not useful in, it is very important, it is not useful in corrosives, that is acid and alkalis, cyanide, alcohol, heavy metal poisoning and hydrocarbons. Now what is chemical antidote? They counteract the action of poison by forming harmless or insoluble compounds or by oxidizing poison when brought into contact with them. Now, for some examples of chemical antidote are common salt. For silver nitrate poisoning, it converts silver nitrate into insoluble silver chloride. Albumin is used as to precipitate mercury chloride. Dialyzed iron is also used in mercury chloride. Copper sulfate, it is used for phosphorus poisoning. Potassium permanganate, 1:5000 concentration. It is used in opioids, strychnine, phosphorus, cyanides, barbiturates and atropine poisoning. Lugol's iodine, it is used in lead, mercury, silver and strychnine poisoning. Tannic acid 4% or tannin, it is used in apomorphine, cinchona, strychnine, nicotine, cocaine and heavy metal poisoning. Now we will discuss about the coma cocktail. It is a cocktail which is given in comatose patients when identifier of poison is not known. Then when the poison cannot be identified, then this cocktail is given. It includes 100 milliliter of 50% glucose, 100 milligram thiamine and 2 milligram of naloxone. They all are given IV. Similar like this, we have universal antidote. It has activated charcoal of 2 parts, magnesium oxide as 1 part and tannic acid as 1 part, but it is not recommended nowadays. The third type of antidotes is physiological or pharmacological antidote. They act on tissues and produce symptoms exactly opposite to those caused by poison. Now, these are the various antidotes and these are the various poison. I will dictate them for you. The first antidote, that is atropine or pralidoxin. It is used in poisoning by organophosphates. Amyl nitrate is used in cyanide poisoning. Ethanol, fomepizole, formic acid. They all are used in methanol poisoning. Nalmefene and naloxone. It is used in opiate poisoning. Sodium nitrite, sodium thiosulfate, hydroxycobalamin, it is used in cyanide poisoning. Flumazenil, it is used in benzodiazepine poisoning. Pyridoxine, it is used in isoniazid poisoning. Vitamin K, it is used in anticoagulant rodenticides. And N-acetylcysteine, it is used in acetaminophen. Now, what are chelating agents? They are used for heavy metal poisoning. They form a complex with metals which is more water soluble than metals, resulting in higher renal excretion of complex. The first is BAL, British anti-Lewisite, or also known as dimercaprol or dimercaptopropanol. It is used as a physiological antidote in arsenic, lead, bismuth, copper, mercury, gold, and thallium, and antimony. It is given as deep intramuscular injection due to its oily preparation. It is analog. The analogs of BAL are DMSA, also known as Succimer, and DMPS. It is contraindicated in liver failure, G6PD deficiency, iron and cadmium poisoning, and peanut oil hypersensitivity. Now, second is chelating agent is calcium disodium edetate, also known as EDTA or edetamil or edetic acid or versine. It is used in treatment of choice in lead poisoning. It is superior to BAL in treatment of arsenic and mercury poisoning. The dose for EDTA is 25 to 35 milligram per kilogram in 250 to 500 ml of 5% glucose, and it is given as IV. The third chelating agent is penicillamine, also known as cuprimine dimethylcysteine. It is a hydrolysis product of penicillin. It has maximum efficiency for MLC, that is mercury, lead, and copper. Another is desperioxamine. It is very useful in acute iron poisoning. Also used to promote removal of radioactive heavy metals. The dose is 8 to 12 gram per day